Hello and welcome. Today we're diving into the world of herpes simplex virus, specifically focusing on the type that commonly causes those pesky cold sores. We'll explore everything from what causes them to how they're treated and prevented. Get ready to learn about cold sores, the facts, the fiction, and everything in between. What triggers these irritating outbreaks? Cold sores, also known as fever blisters, are primarily caused by the herpes simplex virus type 1 or HSV1. While HSV2 is more commonly associated with genital herpes, it can also, albeit less frequently, cause oral herpes. The virus is highly contagious and is usually contracted during childhood, often through non-sexual contact like sharing utensils, kissing, or even touching a contaminated object. Once you're infected, the virus lies dormant in your nerve cells, waiting for a trigger to reactivate. So, what actually happens when the virus wakes up? After the initial infection, the HSV1 virus travels along the sensory nerves to a nerve cluster called the trigeminal ganglion, located in the face. It settles there, remaining inactive for potentially years. When triggered by factors like stress, sunlight exposure, hormonal changes, illness, or even skin trauma, the virus travels back down the nerve to the skin, replicates rapidly, and causes inflammation. This results in the formation of small, fluid-filled blisters, the characteristic cold sores. These blisters eventually burst, forming a crust that gradually heals, but the virus remains dormant, ready to reactivate again. Cold sores are incredibly common. It's estimated that over half of adults in the United States carry the HSV1 virus. However, not everyone who carries the virus develops visible cold sores. Many people are asymptomatic carriers, meaning they have the virus but never experience outbreaks. The prevalence varies depending on factors like age, socioeconomic status, and geographic location, but globally, it's a widespread condition that affects a significant portion of the population. The first sign is often a tingling, itching, or burning sensation around the lips or mouth, usually a day or two before the actual sore appears. This is the prodromal stage. Then, small, painful blisters erupt, usually on or around the lips. These blisters fill with fluid and eventually rupture, forming a yellowish crust. The cold sore can be quite painful and may cause difficulty eating, drinking, or even speaking. The entire outbreak typically lasts for 1 to 2 weeks. Diagnosing cold sores is usually straightforward. The characteristic appearance of the blisters is often enough for a healthcare professional to make a diagnosis. In some cases, a viral culture or PCR test can be performed to confirm the presence of the HSV1 virus, especially if the presentation is atypical or if other conditions need to be ruled out. These tests involve taking a swab of the sore and sending it to a lab for analysis. While there aren't distinct classifications of cold sores beyond being caused primarily by HSV1, it's worth mentioning that the frequency and severity of outbreaks can vary significantly between individuals. Some people may only experience a few outbreaks in their lifetime, while others may have them several times a year. The triggers also differ from person to person. Unfortunately, there's no cure for herpes simplex virus, but there are effective ways to manage cold sores and reduce the frequency and severity of outbreaks. Topical antiviral creams like aciclovir, penciclovir, or docosanol can shorten the duration of an outbreak and relieve pain. Oral antiviral medications, such as aciclovir, valacyclovir, and famciclovir, are also available and are often prescribed for severe or frequent outbreaks. Over-the-counter pain relievers can help manage discomfort, and keeping the area clean and moisturized can promote healing. Prevention is key to minimizing cold sore outbreaks and preventing transmission to others. Avoid sharing utensils, towels, and other personal items with someone who has a cold sore. Avoid kissing someone with a cold sore. Protect your lips from sunlight with lip balm containing sunscreen. Manage stress through relaxation techniques like meditation or yoga. Identify and avoid your personal triggers, such as specific foods or weather conditions. If you're prone to frequent outbreaks, your doctor may prescribe suppressive antiviral therapy to prevent recurrences. The prognosis for cold sores is generally good. While the virus remains in your body for life, outbreaks typically resolve on their own within 1 to 2 weeks. Recent research is focused on developing more effective antiviral medications and exploring potential vaccines that could prevent HSV1 infection or reduce the frequency and severity of outbreaks. Some studies are also investigating the role of the immune system in controlling the virus and developing strategies to boost the body's natural defenses. Stay tuned for future advancements that could further improve the management and prevention of cold sores.